The Community Education Channel presents Community View, a closer look inside community issues that matter. It's a glimpse, a preview, bringing public perception to light on local community issues that make a difference. Hello and welcome to Community View. I'm Melissa Anderson. With COVID-19 still knocking on our doors across the world, we're still trying to get a handle on the virus and how to eventually treat it. There are many uncertainties, especially with how it may continue to spread. With us today to talk about this is Dave Heaton, who's the Public Information Officer at the Southwest Utah Public Health Department. Welcome, Dave.
Hi, Melissa. Thanks for having me.
Yeah, thanks for joining me. Now, just recently, 2 Washington County commissioners and 10 mayors signed a joint proclamation strongly recommending that the public wear face coverings inside all buildings and outside when people can't be 6 feet apart. Do you think this will help mitigate the spread of COVID-19? Do masks really work?
We think they do. On their own, they're probably not as effective as we would like to mitigate the pandemic, but when you combine masks with social distancing, people staying home if they're sick, proper hand washing, hygiene, and contact tracing, I think they do become an important tool. Early on, the public got some conflicting messages from health authorities about the usefulness of masks for the public, so understandably people might be skeptical or confused. But more recent research, which has been scanned and put together by some scientists at Brigham Young University, they released it a couple of weeks ago, indicate that recent COVID-19 specific research for masks indicate that their main usefulness really is protecting other people in case you are infectious and perhaps don't know it. And so as a tool that you wear out in public, if you're going to be around other people, especially inside buildings or around loved ones who might be vulnerable, again, the main purpose of a mask, and hope it should have at least 2 layers, but it can be the cloth one, the surgical kind. It looks like it may have a decent % chance of keeping other people from being infected by your germs.
So what do we currently know then about the spread of COVID-19 from asymptomatic or pre-symptomatic people?
So we don't know a lot, and sometimes there's a delay in the data. You know, it may be when this pandemic is over, we're able to look back and say, wow, here's the real numbers, here's what we were going through at the time. But it's interesting to note that the Centers for Disease Control has calculated that for every 1 positive known case that we have, there could be up to 10 other positive cases in the community that either never had symptoms or were sick and never sought medical attention or testing themselves. And so that could really, that would be an interesting number to figure out if that turns out to be true. There's also in northern Utah a study going on using antibody testing, where they're trying to test enough people to kind of come up with a study of, how many people do have antibodies built up. Is there immunity that has existed that might influence the numbers? And so there's things going on that will, I think, show us those numbers down the road. But right now, we don't have really solid data on that.
So it seems somewhat of a mystery then that some people get COVID-19 and show symptoms and some people don't. What percentage of the people might be carrying it then and not even know it, or do we know?
Well, I guess we could give that guess from the CDC's figure that there could be basically 90% of people that actually are infected either never have symptoms and don't know it, or had mild symptoms and it wasn't enough for them to get tested or call their doctor. And so that is one way of looking at it.
And that brings up another question. Is the testing reliable? And should a person get tested even if they don't have symptoms?
The current test, it's called the PCR. That's the thin nasal swab that's put back in your nasal cavity that's a little uncomfortable for most people when you get that test done. But that's quite accurate. That test is taken by the testing facilities. There's at least 1 in each county in our district, send up to the state lab, and then the patient and we as the local health department get those results within 2 to 5 days. And then we contact that person, verify it, and kind of go from there as far as contact tracing. And so, yeah, the current PCR test to see if you currently are infected with COVID-19 is pretty accurate. The antibody test, which takes a blood sample and is supposed to determine if you've got the antibodies for COVID-19 that you were exposed sometime over the past few months, isn't quite as accurate. In fact, the accuracy, or the inaccuracy, I should say, is a little notorious. And so really the main usefulness of antibody testing is for research, where they're able to take enough samples where they can look at trends, rather than somebody saying, I'm going to go get the test, to prove whether or not I had it before, and then maybe I'm immune. If you turn up positive for the antibody test, that doesn't guarantee that you have any immunity, and it could be a false positive or a false negative. And so the gold standard right now really is that PCR nasal swab test. We also have a new antigen test um, that can also be in the form of a swab that gives results within minutes. And we have a couple of locations that are starting to provide that in our district. And so hopefully that will become available in the near future as well.
So how long can a person be a carrier of COVID or be asymptomatic and carry it? Do they carry this antibody or whatever they're carrying for life, or at some point will they ever test negative and or get the infection?
Most people that become infected, when we used to do more testing to confirm that they were negative, would test negative and we would consider it done. There have been a few people, though, that continue to test negative quite a while after they've had symptoms. And we're not quite sure what that means. Sometimes those people are told, be off quarantine, watch for other symptoms, and people around them don't seem to be infected at any noticeable rate. And so there's these, like you say, mysterious aspects of this pandemic, this disease that may remain mysterious for some time.
Yeah, you mentioned something about quarantine. So if you haven't had any symptoms, but you were around someone who tested positive for COVID, you must also quarantine. And that's up 10 to 14 days, depending on whether you test negative or positive. Is that long enough to quarantine before going back or re-entering society if you're asymptomatic and you don't really know?
Yeah, that is the current standard. So if you were exposed, and the current definition of exposure is that you were within 6 feet of someone for at least 10 to 15 minutes who ends up testing positive for COVID-19, you're considered an exposure, and it's recommended that you at that point quarantine for a period of 14 days, and that's considered plenty of time that if you don't get sick, you probably don't have it. If you do get symptoms during that time, of course, you want to go get tested to see if you're positive. And some places will test you if you're just curious, even if you don't have symptoms, if you want to find out and kind of put your mind at ease. But they'll usually have you wait several days, because if you get tested too quickly after exposure and you don't have symptoms, you have a greater chance of getting a false negative. And so sometimes they'll say wait to 5 to 7 days if you don't have symptoms, then come in and we'll test you. And then sometimes it's another 2 to 5 day wait. So it's a waiting game anyway. But some people have gone ahead and done that, been tested even if they don't have symptoms, if they've been exposed.
Now we've got schools starting up just around the corner. They're requiring masks, just as the county and the cities are right now in school, to protect both the teachers and the students and the staff and the school bus drivers and everywhere. At some point, do you think this is going to be enough to wear the masks and do the physical distancing and things like that, or will we be possibly looking at testing students or teachers?
Well, that would be tough to test them on a regular basis, even if you had the rapid test.
His mother.
To be able to do a large number of people within a short amount of time, as far as the expense, the manpower, that may not be realistic. And so it's interesting to note that the goal that we've always had in public health with facing this pandemic has not been to stop it. That's virtually impossible. It's been to slow the spread enough to protect our healthcare resources and our most vulnerable people and try to reduce deaths as much as possible. The way we do that are imperfect. So again, we're not trying to stop the virus, we're trying to slow it down. And if you have several tools at once, it lowers the chances of that. No setting is risk-free. A person out there we've had people test positive that said, I've done everything. I didn't go out, I wore a mask, I washed my hands. Nature finds a way. And so no one is risk-free, but we believe we can drop that risk significantly and have an impact on the spread by combining things like masking, social distancing, staying home if you're sick, contact tracing. Those things together, I think, right now give us the best chance of dealing with this the best that we can. And it's controversial as far as going back to school. You look at any child expert, whether it's for education or health, we want to protect the health of our kids and their families, but at the same time, this hasn't been necessarily a fun summer vacation for most kids. I know it hasn't been for mine, as far as education, learning, psychology. I think it's vital that we look at the cost benefits and be willing to walk a moderate line, the one that we can make as safe as possible to move this forward. We had the same discussion come up when we were looking at the different levels as far as economic and business openings in our districts. I really like what Governor Herbert said. He said we don't have to choose between the economy and health. We can figure out a solution that takes from both and it's not going to be perfect. It may have to be revised. I think that's the same with schools. We don't have to choose between education and health. Uh, our school systems were very creative this last spring. We think they could be creative again. It's not ideal, but I think our kids and our teachers can rise to the occasion and still be safe.
Yeah, well, let's hope they can. Now, I've heard that the method of reporting has changed for health departments or even nationwide. Can you tell us how that works? Does it go to the state when you come up with numbers? How does it work?
Well, the most accurate numbers, at least, and especially in Utah, I think, are going to come from your local health district. When a person goes and gets tested, that is sent up to the state lab, and then we and that person are notified within 2 to 5 days of the positive test. Then our contact tracers will reach out to that person, interview them, make sure they live in our district, make sure it's not a duplicate case, and start to do contact tracing with them. And so every case that we've counted in our district is a real person. We're not double counting, we're not estimating. In fact, when all is said and done, even compared to the state number for us, ours will probably be a little bit lower because we've been able to weed out some duplicates and maybe some error cases that came our way.
Are there any other unknowns at this point with this COVID-19? I mean, it does seem kind of mysterious in the way that it acts and what it does, but it's similar to the flu. Some of the symptoms are similar to the flu, but then again, it isn't, because it's not as typical, because it does not show itself. I mean, it's kind of a hidden disease or a hidden virus.
It can be, you can be exposed and infected and not show symptoms for 2 to 14 days and be spreading it during that whole time. You're right. We can draw similarities with the flu because it is a respiratory virus. It spreads in many of the same ways. Many of the symptoms are similar. Many of the complications are similar as far as turning into pneumonia and sometimes even death for vulnerable people. But the COVID-19 seems to spread faster than the typical influenza. And when all is said and done, I think this may end up indeed being the worst pandemic we've had since the flu pandemic of 1918. So this may be our biggest in a century disease that's looking to head that way. We want to remind people, though, that it's cause for concern. We want to be careful. We want to protect ourselves and others, but also to give people hope and maybe give them information over fear. In Utah, we have the lowest death rate from COVID-19 in the nation. You have over a 99% chance of survival if you become ill and test positive. It's the older folks who are over 60 and have underlying health conditions that really take the brunt of complications and end up getting hospitalized and sometimes passing away. And that's, again, where we want to put our attention. For the most part, kids, even down to infants, it's very rare for them to have a serious form of COVID-19. And so that's the good news. But they can spread it. We don't know how good they are at spreading it, but even if kids get together and don't really get sick, there's a possibility they could bring it home to mom or dad or grandparents. Sometimes that's how it works. Regardless of whatever a school district does in this country, whether they do online or meet in person, we'll continue to see cases throughout the community in all age groups. We'll have to watch closely what going back to school face-to-face will do. I think most school districts are doing the best they can to follow the guidelines from the state and make it as safe as possible. Again, nothing's risk-free, but I think there are, enough teachers and parents and students that are ready to go back into school and are willing to do that in person.
And one quick question, is this as deadly as the flu?
I'd have to look at the more recent numbers, but certainly so far, COVID-19 in the United States has had more deaths than recent bad flu years. And so I think when you're looking at fatalities, it does seem to be, as far as that goes. And again, fatality rate compared to total of number of positive cases, we just won't know that for a while. We may never know exactly. But I think you could say this is at this point deadlier than the flu.
If people want any more information on testing or what they should do to quarantine or any of that, how can they get a hold of you?
The best place to go is our website, and that's swuhealth.org. As soon as you go there, click on the COVID-19 page, and you'll see buttons right away of how to get tested, how to get a guide for keeping your business safe, how to open your school up and keep it safe. It gives, we update it daily with the current numbers divided out by county, recoveries, hospitalizations, fatalities. We try to provide all the resources we can in one place. A lot of people also go to our Facebook page, which is also SWU Health, where we also post daily, usually around 2 o'clock or 2:30 with the most recent numbers.
All right. Well, I'd like to thank you for joining us, and also that you stay safe as well. And for our viewers out there, we encourage all of you to, continue to be vigilant. As he said, this could be a very deadly virus to many people. So you just need to stay safe, and if you can, wear that mask and heed the warnings, because this is something that could be as deadly as the 1918 pandemic. And we just like to say thank you for joining us, and stay safe and have a great day. Thanks for watching.